Good morning, everyone. So today we're going to do a presentation and a lesson about primary assessment. First off, an introduction. My name is Kyle Pagetto. I work at the JIVC Fire Department as a firefighter, and I'm trained as an emergency medical responder. I like bike riding, everything outdoors, and that's me. So, the purpose of a primary assessment is, upon arrival at the scene of an emergency, it is important to quickly assess scene safety and conditions and assess whether the patient has any life-threatening injuries or conditions by conducting a primary assessment. This includes assessing the ABCs, which is airway, breathing, circulation, level of responsiveness, and checking for deadly bleeding. Once the primary assessment is complete, you can begin your secondary assessment. Having a clear plan of action will help you to respond effectively in any emergency situation and increase the patient's chance of a positive outcome. Before we start, our learning objective today is that you, the student, will demonstrate knowledge of the components of the primary assessment and be able to demonstrate some of the physical skills for the primary assessment, in this case 3, on a responsive patient according to department SOPs. Quick safety briefing. When we're working with patients, we're going to be wearing our PPE, which is gloves, eye protection, and a mask. Bathrooms are right behind you, and our exits are up the stairs here, and our muster point is going to be across the street at the Tim Hortons. So, what a primary assessment is a rapid, systematic check of the patient. You're making a quick assessment, thorough, logical, but quick. You're going to identify conditions that pose an immediate threat to the patient's life. So in the case of an airway, it could be an obstructed airway. Circulation, it could be an absent pulse. Deadly bleeding, more obvious, you're looking for deadly bleeds. It is ordered so that it will typically identify the highest priority conditions first. As I said, it's ABCs, airway, breathing, circulation, followed by deadly bleeding. As I said, the primary assessment has a number of components. So first off, introducing yourself, which is simply just saying hello to the patient. My name is blank, and I'm a firefighter, EMS, first responder. Next, you would assess the level of responsiveness, which we'll get to in a couple slides. After that, simultaneously assessing the ABCs, airway, breathing, circulation, including a pulse check, and lastly, performing a rapid body survey, which we're going to refer to as RBS. So, the introduction, pretty simple. My name's Kyle, I'm a firefighter, can I help you? You're going to get consent from the patient, then ask what the chief complaint is. Chief complaint is simply what seems to be the problem. What is the issue that patient is having? The patient's answer is their chief complaint. They could say, oh, I'm having trouble breathing, I'm bleeding from my leg. Whatever they say is the chief complaint. It is always an injury or a condition. It's not a symptom or a feeling. As I said here, it could be you're going to treat trouble breathing. This is a possible breathing emergency. If the patient is unresponsive, obviously they can't answer this question, and the chief complaint is unresponsiveness. So as I said, the first step is to determine the level of responsiveness, or LOR. Determine if the patient is responsive, as unresponsiveness usually indicates a very serious medical emergency. LOR refers to the level of responsiveness, and ABPU is a little way to remember the 4 levels. So alert, patient is functioning normally, their eyes are open, they're talking to you. Typically the best way to determine this is simply saying hello, introducing yourself, maybe a tap on the shoulder if you're approaching from behind or the side. Next, the patient is responding to verbal stimulus. Maybe their eyes are closed or they're not able to show their alertness through their eye movement, but when you talk to them, they're going to respond and may be able to follow a command. You determine this simply by talking to them. Next, painful. So if a patient is not alert or verbally responsive, you would check by giving them the painful stimuli. In this case, we're going to talk about a sternum rub, which I will demonstrate later, but you can also do a fingernail pinch or a trap pinch. Both may elicit a response in the patient, and you'll know they're responsive to painful stimuli. Lastly, if they don't respond to any of the alert, verbal, or painful stimuli, they're considered unresponsive. They haven't responded to anything you've done. Next, we'll move on to the ABCs. First thing you do is airway. Check if the airway is open. A speaking, moaning, crying patient has an open airway, otherwise they wouldn't be able to make these sounds. You can move on from A if the patient is alert and talking to you. If they are not and they're unresponsive, you can do a head tilt chin lift. As you can see in the graphic here, it simply moves the tissue of the mouth and tongue out of the airway and may solve the problem. If it is a partial or full blockage choke, this may not have an effect, but if it is simply a tongue being relaxed and blocking the airway, tilting the head and lifting the chin can solve that. Next, you would assess breathing. For an unresponsive patient, you're going to position that patient so you can hear and feel air from the patient's nose and mouth on your cheek. At the same time, you're going to look at the patient's chest rise and fall. You're going to do this for about 10 seconds. Again, if the patient is talking to you and alert, you can assume they are breathing and know that the A and B are there, and move on to circulation. Circulation simply refers to checking a patient's pulse. You must determine whether the patient's heart is beating. The method of assessing circulation is different for infants, adults, and children. Infant, you're going to assess on the brachial artery, which is right here. Child or adult that is responsive, the radial, which is on your wrist. And a child or adult that is unresponsive, carotid, which is on either side of the neck. Again, you're going to assess the patient's circulation for a maximum of 10 seconds. Lastly, you would perform a rapid body survey, which is a quick hands-on check that it allows you to quickly identify life-threatening injuries and conditions. Most importantly here, you're going to be looking for deadly bleeding. A lot of blood's on your hand when you're touching someone. Systematic. This is something you're going to go follow a specified order that is going to look at the most important areas first. Order, as noted, head, neck, chest, abdomen, pelvis, lower extremities, upper extremities, and lastly, back. You're going to palpate each area and check for blood on your gloves regularly. So now we're going to move into a demonstration. So, please have a seat. Okay, so I've already checked that my scene is safe and my PPE is on. I have gloves, eye protection, mask. I'm just going to drop the mask because we live in the same household. Hi there, my name's Kyle. I'm a firefighter. Can I help you?
Yep.
What seems to be the problem?
My leg is bleeding.
So I'm just going to assess your level of responsiveness, which is alert. Okay, so this was a full speed demonstration of how you do a very quick primary assessment. Now I'm going to do another demonstration, slow it down, explain each step so you can hear me. So when I came in, the first thing I said is my scene is safe. I've done my scene assessment and ensured there's no dangers for me and I can continue with my assessment. Next, ensure your PPE is on, as I mentioned, gloves, mask, eye protection. Then I approached the patient and I asked them the question and introduced myself. I said, "Hi, my name's Kyle. I'm a firefighter. Can I help you?"
Yes.
Yes. So first thing, I received consent to help the patient. I let them know my level of training, and then I moved on and asked what the chief complaint is. What seems to be the problem?
My leg was bleeding.
Okay. So I know the leg is bleeding. My patient is speaking to me, breathing. So my A and B, airway and breathing, I know are present. So then I did a circulation check. I put my hand around her wrist and I lined it up along her thumb line. Put 2 fingers, held gently, and assessed the pulse for 10 seconds. Next, what I did was a rapid body survey. I still went systematically, head to toe, but here again, if you knew there was an issue on the leg, you could have skipped right to the leg. Any questions?
Not yet.
Okay. Now that we've completed the demonstration on a responsive patient, we're going to do a demonstration on an unresponsive patient. As I said, first things first, scene safety is done, my PPE is on, except the mask. Hi there, I'm Kyle, I'm a first responder. Can I help? Hello? Hey, is everything okay? No, patient is unresponsive. Airways clear. Now we're going to do a broken down version, slower pace, and I'll explain everything I'm doing. So, as I said, I enter the scene, my scene assessment's been completed, and I know there's no safety concerns. My PPE is on. Again, the first thing I do is approach the patient and introduce myself. Hi, my name is Kyle, I'm a firefighter, can I help? I don't get a response. Start tapping on the shoulder. No response. So they are not alert verbally, they are not alert or verbally responsive. Next thing I'm gonna do is a sternum rub. I'm gonna take my knuckles, put it on the sternum and rub. This is very, very painful and would be a very good stimuli if someone was responsive to pain. This patient is not responsive to the sternum rub, So I continue. My patient is unresponsive. Since my patient is unresponsive, I need to start with checking the airway. I do a head tilt chin lift, open the mouth. I don't see anything. My airway appears to be clear. Next, I'm going to check breathing and circulation simultaneously using a carotid pulse, because this is an adult that is unresponsive. Maintain my head tilt chin lift, slide my fingers down to the side till I feel the pulse. And I'm also looking at their chest, seeing if their chest rises and falls, and I can also feel any air coming out of their nostrils on my face. I'm going to assess them in this method for 10 seconds. And then lastly, I do a hands-on rapid body survey, checking for any bleeds, starting most importantly at the head. Palpate, check my hands, check the neck, the back of the neck. I don't see anything. Down the chest, nothing. Sides of the abdomen, I don't see anything. Front, left leg, checking my hands. Nothing. Nothing. Arms, again, no bleeding. Check the back. Nothing. Now that you've seen both assessments on a responsive and unresponsive patient, you're going to demonstrate on me.
Okay. Okay, so I have my PPE on and I know that the scene is safe. I'm just gonna take my mask off because we're in the same household. So I'm going to approach the patient and I'm going to say, hi, my name's Hillary, I'm a first responder. Can I help you?
Yes.
Okay, so I have consent, and then I'm going to ask you what seems to be the problem.
Oh, I'm just having a little trouble breathing.
Okay, so since you're talking to me and responding, I know that airway and breathing are present, so I don't need to check for that. So I'm going to move on and check for circulation. I'm going to check this for 10 seconds. And there's a pulse, so I know that you have circulation present.
Yes. Now, why did you check my radial pulse and not my carotid?
Because you're an adult who is responsive.
Correct. Okay. Great job.
Thank you. Okay, so I'm getting my PPE on. I have my gloves, my mask, and my goggles. I'm just gonna pull the mask down because we're in the same household. And I'm going to start by approaching and I'm going to say, hi, my name's Hillary. I'm a first responder. Can I help you? And I see that you're not responsive. So I'm going to get down here and I'm going to tap you and you're still unresponsive. So I'll do a light sternum rub with my knuckles and there's still no response from you. So I'm gonna do ABS. I'm gonna check, do a head tilt, check airway, and then I'm gonna check breathing and circulation at the same time. So since you're an unresponsive adult, I'm going to have my fingers on your carotid artery and I'm going to watch your breathing for 10 seconds. And also feeling any breath through the nose with my cheek. And I think that's it.
Okay, really great job. I think you hit on everything. The one bit of feedback I'd give you would be once you've checked my airway and begin to assess my breathing and circulation, maintain the head tilt, chin lift, so the airway doesn't happen to close itself again. So
Right.
simply one hand on my forehead, keeping it tilted back, the other hand on my carotid will solve that. But
Okay.
great job. Now for our evaluation portion of this presentation, we're going to do an online quiz from Kahoot. So please follow the pin here. Go to this website on your phone, enter the game pin, and we will start the game. Okay, let's start. So, get ready. Question number 1. What is completed before the primary assessment? So far, so good. What is the first step of the primary assessment? Great job. Where do you check circulation on an unresponsive adult patient? Nice job again. ABCs stand for airway, breathing, condensation. True or false? Nice work.
Circulation.
You got it. A rapid body survey checks for great work. True or false? A circulation check on an infant is completed on the brachial artery. Bingo. Which of the following is not considered a level of response? Nice job. True or false, you assess a patient's airway and breathing for a maximum of 30 seconds.
It's 10.
Exactly. Question 9, a rapid body survey starts at the blank. Right. And the last one, see if you can get a perfect 10. Having a clear plan of action will help you respond effectively and increase the patient's chance of a positive outcome. True or false? That was a gimme. But great job, 10 out of 10.
Did I win?
You did. Okay, in conclusion, students should now understand how important a thorough and efficient primary assessment can be for a patient. I really want to thank everyone for their time. I hope this was enjoyable and effective and interactive. Do you have any questions?
Yeah, is there ever a time when doing ABCs completely is wasting time? Like if you see very obvious deadly bleeding and major cuts or injuries and the person is not responsive or isn't speaking to you, can you ever just jump straight to solving that? And dealing with injuries if they're really severe and
I
time is
would-
being wasted?
I would say yes if it's something very obvious. What comes to mind would be circulation emergencies like an amputation where you know what the problem is. It's very obvious to you upon approach. And yes, I would say still, I'd still quickly take a look at ABCs, but not as thorough. Go right to the problem. So yes, that would be applicable in this case.
And is there ever a pulse when there isn't breathing? Like, or if you check, or is there a pulse? Is there no pulse and there is breathing? So if you were like, I'm just gonna skip, or no, if you were gonna do airway, check airway and breathing, and it's present, and then you go to check pulse and there's no pulse, does that happen? Can you be breathing without a pulse?
Yes, there's something called agonal respirations, where it looks like breathing. The patient may have a chest rise and fall, and they may be making noises, but it's not effective breathing.
Okay.
So it's kind of just a body's reaction, and yeah, it can fool you into thinking breathing is present and therefore circulation would be, but that might not be the case.
I think that's it.
Okay, thank you for your time.